Thank you, Leader. So, unless the Senate and the House act this week, in a few days, millions of Americans are going to face a god-awful choice. Do they pay thousands more to keep my health care, or do I take the risk of going without? Democrats have offered a simple solution. Let's extend the tax credits without making changes at the 11th hour. After that, let's see where we can work together to make the health care system better. Late last night, Republicans in the Senate revealed their alternative. Increase insurance premiums by thousands of dollars and deductibles by thousands more, and give people a snake oil alternative, a savings account. And they don't even do anything about criminal penalties for fraudsters the way we do. I'm going to use two examples to illustrate how disconnected the Republican plan is from the reality that Americans face. First, imagine a woman nearing Medicare age who's battling breast cancer. She's going to have another round of chemo in January, so she needs to sign up by next week. Crumbs in a savings account are not going to do much for her. Maybe she'll find out as we go that we have a better alternative. We're also going to imagine a young couple planning to start a family next year. Giving birth costs thousands and thousands of dollars, and they want to be prepared with the right insurance plan. Looking at the current premiums for a plan that covers their hospital stay isn't going to do much for them. These are two examples of the kitchen table conversations that are happening right now as Americans sign up for insurance. The Republicans offer crumbs in terms of insurance company profiteering and snake oil. To make matters worse, their proposal is riddled with ideological trophies like anti-abortion language. It shows that once again, Republicans weren't interested in compromise. Later this week, Americans will have the opportunity to see whose side senators are on.
Good afternoon. Thank you all for being here. It might be helpful just to take this conversation out of Washington and invite you down to Georgia, where I'm hearing from constituents every day what this is going to mean for them right now. I heard just a few days ago from one of my constituents, a single mother with 4 children, who gets her insurance through the Affordable Care Act exchange. And her medication costs $20,000 per dose. She needs 4 doses per year. Her premiums are about to go up by 500%. I heard from another constituent a few days ago, a woman in her early 60s who waits tables for a living, who's fighting breast cancer. She needs chemo monthly. Her premiums are now going to be $500 per month. She can't afford it. She's going to have to give up her insurance in the middle of chemotherapy while she's fighting breast cancer. What are people supposed to do when they lose health insurance in the middle of a cancer battle? What are parents supposed to do who already can't make ends meet, who are going to see their premiums go up 500% when they need life-saving medicine that without insurance costs $80,000 per year? So in this building, maybe it's about the politics, but in the real world and in Georgia, this is life or death. 500,000 Georgians are projected to lose their insurance altogether. Millions more will see huge increases in their health insurance premiums. My constituents cannot afford this. Some of my constituents cannot survive this. And so I'm calling on our Republican colleagues to put politics aside. It is almost Christmas. It's almost the holiday season. We should let our care and concern and goodwill for our constituents motivate us and guide us in these next few days. There's an opportunity on Thursday to come together and prove to the American people that no matter how divided we seem, we can unite to prevent these catastrophic increases in health insurance premiums. Thank you all.
So as a part of the ongoing Jedi mind trick from this president, he this week made the absolutely incredible